Hello everyone. In this video, we are going to talk about the chapter Reproductive Health. And this chapter is a part of Class 12 CBSE syllabus. And in this particular video, we are going to talk about the part 1, that is birth control and contraception. Generally, there are like 2 to 3 questions on the reproductive health chapter in NEET examination. And the questions from this part, birth control and contraception, generally focus on like what is the mechanism of different contraceptive agent. And generally there are some match the following questions. So we will see what comes up in this chapter. So first we start with certain key terms. And the first key term that we must know is amniocentesis. Amniocentesis is a fetal sex determination test that is based on the chromosomal pattern in the amniotic fluid surrounding the developing embryo. So in this particular test, they take the amniotic fluid from a pregnant lady and subject it to chromosomal patterning. And then we get the pattern of autosomes as well as the sex chromosomes. And once we have pattern of both the autosomes and the sex chromosomes can tell us the sex of the baby that is not even born. We all know that if the sex chromosomes are XX, it is a baby girl. And if the sex chromosome is XY, the presence of Y makes it a baby boy. And therefore, by doing this chromosomal patterning, we can determine the sex of the baby even before the baby is born. In India, however, this test has been banned. This is because there was an increased case of female feticide. That is, people were aborting the girl child even before it was born. That led to a ban on amniocentesis. However, in certain cases, amniocentesis is important. For example, certain chromosomal related disorders. For example, Down's syndrome. So in Down syndrome, there is trisomy of chromosome number 21, that is an autosome. So there are 3 copies of chromosome number 21. And therefore, doing amniocentesis can help us to detect that whether the baby has Down syndrome or not. Similarly, any chromosome-related disorder can be detected for amniocentesis, and in such cases, amniocentesis is very important. So this whole concept of amniocentesis is very important, and there are sometimes questions on this. We should really remember that amniocentesis tells us the sex of the child even before it is born, and it also gives us information about any chromosomal abnormalities. In this test is performed during 14 to 20 weeks of pregnancy. So the next important term that we need to know is the infant mortality rate. Infant mortality rate is the number of infant deaths per 100,000 live birth in 1 year. So the number of infants that are less than 1 year of age that have died per the 1,000 infants that are born in 1 year will give us the infant mortality rate. And just as we have the infant mortality rate for the infants, we have the maternal mortality rate for the mothers. So the maternal mortality rate is the annual number of female deaths per 100,000 live births during pregnancy, childbirth, or within 42 days of termination of pregnancy, again for one given year. So in maternal mortality rate, the number of female deaths that have taken place either during pregnancy, childbirth, or within 42 days of termination of pregnancy per 100,000 live birth is known as the maternal mortality rate. However, due to advancements in science and technology, both the infant mortality rate and the maternal mortality rates have been decreasing. Okay, so now we come to birth control, which is one of the most important topics of this part. So birth control refers to restricting the number of children by various methods, and these various methods are the contraceptive methods that are designed to control fertility and to prevent conception. So these contraceptive methods help in preventing unwanted pregnancies. So what happens is, in certain cases where the couples are not yet ready to have babies, or in certain cases where they want a defined gap between the birth of two babies, sometimes if they are not using an active contraceptive agent, it can lead to unwanted pregnancies. Therefore, the use of a contraceptive agent is very important in such situations. An ideal contraceptive agent or an ideal contraceptive method should have certain properties. It should be user friendly, so that it is very easy to use. Okay. Like it should not be very complicated so that people have to read large manuals and things like this. So it should be user friendly. Definitely it should be affordable so that everybody can buy it, and it should be readily available so that people can buy it whenever they want. Of course and obviously it should be effective, and it should not interfere with the sexual desire or drive or act of the user. Therefore, an ideal contraceptive agent should possess all these properties. So there are majorly 4 categories of contraceptive methods. The first one is natural methods. The second one is barrier methods. The third one is hormonal methods, and the fourth one is the surgical sterilization. And we will go through each one of these methods one by one. And to start with, we will first start with the natural methods. So the first natural method that we will talk about is called as periodic abstinence. And to understand periodic abstinence, let us revise the menstrual cycle wheel of the menstrual cycle in a woman. So the menstrual cycle consists majorly of 3 phases. The first one is the follicular phase, then the ovulation phase, and then the luteal phase. The ovulation phase is the phase that is also called as the fertile phase, because this is the phase where the chances of pregnancy are maximum. So days 10 to 17 of the menstrual cycle, that is from day 10 to day 17 of the menstrual cycle, are when ovulation is expected and chances of fertilization, that is a sperm meeting the egg, are maximum. So during this ovulation phase, which is from day 10 to day 17, the chances of fertilization are maximum. So what should be the contraception during this case? Periodic abstinence is a method in which couples should definitely avoid or abstain from coitus during this period. That is, they should not have sex during this ovulatory phase. And this is one of the natural methods that a couple can adopt. The second natural method is withdrawal or coitus interruptus. So it is a method in which the male partner withdraws his penis from the vagina just before the ejaculation so as to avoid insemination. So men are generally able to judge, and they should therefore withdraw their penis definitely from the vagina just before the ejaculation. And if they do not ejaculate anything within the vagina, there will be no insemination taking place, and this will be another natural contraceptive method, which is called withdrawal or coitus interruptus, because it prevents the coitus to take place, because the penis will be removed from the vagina just before the ejaculation. So the third method, or the third natural method that can be used as contraception, is lactational amenorrhea. So what happens in this case? This case starts with the birth of the baby. So a child is already born, and when the child is born, it sucks the milk from the breasts of the women or of their mothers. So the breast of the mothers produce milk. This signals the brain and causes suppression of ovulation. So there is no active ovulation that is taking place in the female body while she is breastfeeding her child. And this is called as lactational amenorrhea. So this method is also called as absence of menstruation method, and this is because there is suppression of ovulation when the mother is breastfeeding the baby, and therefore there is absence of menstruation as well. So it is based on the fact that ovulation does not occur during the period of intense lactation following parturition. So there is no ovulation taking place, and therefore chances of having the sperm reaching the egg is very less. As long as the mother breastfeeds the child fully, the chances of conception are almost nil. But there is another thing, This method has been reported to be effective only up to a maximum period of 6 months following parturition. So it is effective only for a period of 6 months following parturition, and after that the couple must adopt to other methods of contraception. So obviously there are no side effects of this method, but the chances of failure of this method are high, because in certain cases it is possible that this period of 6 months is reduced. Therefore, a couple must be very careful if they are following this natural method of lactational amenorrhea. So to summarize the natural methods, the first one that we saw was periodic abstinence, during which a couple should abstain from having sex from day 10 to day 17, which is the active ovulatory phase. The second one is withdrawal or coitus interruptus, where the men should withdraw the penis from the vagina immediately before the ejaculation takes place, so that the sperms are not ejaculated in the vagina. And the third or the last one that we saw is lactational amenorrhea. So lactational amenorrhea is based on the method that during the periods of breastfeeding, a woman generally doesn't have an active ovulation going on. So the couples can have sex during this period, but they should be very careful, because this period of 6 months is always not very strict. So the next contraceptive method we talk about is the barrier method. So we have already seen the natural methods. Now we will talk about barrier methods. So what is the basic concept behind the barrier method? So this figure kind of depicts the female reproductive system. And this is an egg, and these are all the sperms. So the concept behind using a barrier method is that there is a physical barrier that is present between the egg and the sperms to prevent fertilization. So in barrier method, the ovum or the egg and sperms are prevented from physically meeting with the help of barriers. Such methods are available both for males as well as for females. And now we will look slowly one by one what are the available barrier methods. So the first barrier method that we will look upon are the condoms. And most of us might already be knowing about condoms. They are both available for men as well as for women. So these are the barriers that are made up of thin rubber latex sheath that are used to cover the penis in the male, like condoms for male, or vagina and cervix in the female, like condoms for female. They are used just before the coitus so that the ejaculated semen does not enter into the female reproductive tract. So if you are using condoms, the male partner does not need to withdraw the penis from the female reproductive tract. If you are using a condom, you can actually ejaculate within the female reproductive tract because condom, which is a thin rubber latex sheath, will provide the barrier and will provide a proper contraception and will prevent fertilization. Nerode is a popular brand of condoms for the male. So condoms have a lot of disadvantages, but in some cases there are slight disadvantages. So let us look at the advantages. The biggest advantage is the ease of use. It is very easy to use and it is very widely available at a lot of shops around. It can be self-inserted and therefore gives privacy because you do not need to go to any doctor and you can use it just by yourself very easily. It can be easily disposed of. And the most important advantage of using a condom is that it provides protection against sexually transmitted diseases and AIDS. So therefore, this is the most important advantage of using a condoms, that it will protect you against STDs and AIDS. So in some cases, there are also some disadvantages. So they are not always 100% safe. The safety is between 95 to 99%. And in some cases, it can break. Sometimes it can also lead to a decrease in sexual pleasure. And in a very less percentage of people, there can be development of allergies to the latex or rubber with which the condoms are made. And in especially these cases where people develop allergies to latex due to the use of condoms, they should try to use either anti-allergics or they should try to change the contraceptive method. Okay, now coming to the second barrier method. It is called as diaphragm and it exactly looks like this. It is again a rubber but a dome-shaped structure that fits over the cervix. So it can be used only by women. And it is used in conjunction with a spermicide. And spermicide is something that kills the sperms. So this contraceptive method, that is diaphragm, in addition to providing a barrier, will also have a spermicide that will kill if any of the sperms cross it. Again, we will look at some advantages and disadvantages of using diaphragm. So again, the advantage is it can be self-inserted by the female up to 6 hours before the intercourse. So you can already insert it by yourself 6 hours before having an intercourse. So the diaphragm again, because it acts as a physical barrier, stops most sperms from passing into the cervix and the spermicide kills most sperms that do get by. So first of all, this dome-shaped barrier will not allow any of the sperms to pass through it. But let's say if some of the sperms do pass through it, the spermicide will kill these sperms. Therefore, it is a very effective barrier contraceptive method and it can be reused. But there are again some disadvantages. Although diaphragm use does decrease the risk of some sexually transmitted diseases, it does not fully protect against HIV infection because the vagina is still exposed. Therefore, if you are using a diaphragm as a contraceptive agent, be sure that you use it with a well-trusted partner, because it is possible that it might not provide you full protection against HIV. The third barrier method is a cervical cap, and it looks like this. It actually resembles a diaphragm as we saw before. It also is dome-shaped, but the difference is that it is smaller and more rigid, so it won't break that easily compared to the diaphragm because it is more rigid. Again, it fits snugly over the cervix, but it must be fitted by a healthcare professional. So you cannot insert it by yourself. It can be reused, and definitely spermicides should be used with the cervical cap. So when a healthcare professional will insert a cervical cap, there will also be insertion of spermicides that will again kill the sperms. So there are available cervical caps under the name orthocervical cap, mil-cervical cap, etc. So they are really similar to diaphragm, but they require insertion by a healthcare professional. But they are definitely more rigid. The fourth barrier method is known as waltz. It is also a barrier method that is made of rubber. So the barrier is made of rubber and it can be inserted into the female reproductive tract to cover the cervix during the intercourse. It is exactly similar like cervical caps as well as diaphragm that we have seen, and it can be reused like both diaphragm as well as cervical caps. Okay, so the fifth and most important barrier method is the intrauterine device. And this is where some of the questions in the NEET examination are there. So what is exactly an intrauterine device? So if you look at this figure here, you can see that there is an intrauterine device that is inserted through the vagina. So it is a small object which can be made up of plastic, copper or stainless steel that is inserted by a healthcare professional such as doctors or nurses into the cavity of the uterus through the vagina. If you look at the figure, a doctor or a nurse will insert these intrauterine devices that can be made up of either plastic, copper or stainless steel through the vagina into the cavity of uterus. So intrauterine devices or IUDs prevent fertilization from taking place by blocking the sperms entering the fallopian tubes. So they will block the sperms to enter into the fallopian tubes. And they also enhance the phagocytosis, that is again killing of the sperms. So these intrauterine devices are inserted through the vagina into the uterine cavity, and the mechanism by which they work is that they prevent fertilization by blocking the sperms from entering into the fallopian tubes, and they also enhance the phagocytosis of sperms. So these intrauterine devices can be of two different types. The first one is the non-medicated intrauterine devices, and the examples are Lippes loop. So if you look at the figure here of Lippes loop, it is exactly a loop-like structure. So this is a non-medicated intrauterine device that can be inserted into the uterine cavity through the vagina. The second one is the copper-releasing intrauterine devices, and the examples are CUT or CU7. So this is how a copper T or copper-releasing intrauterine devices look like. And what is different about this is that these copper T or copper releasing intrauterine devices release copper ions. And this part is very important because these copper ions reduce sperm motility and fertilizing capacity. So if they reduce the sperm motility, the sperms cannot move. They won't be able to move and they will only stay at one place, and as a result of which no fertilization will take place. The other non-medicated intrauterine devices is multi-load 375, which looks like this. Okay, the second intrauterine device is a hormone releasing intrauterine devices, and the examples are Progestarset, LNG20, etc. So the implantation is hampered by making the uterus unsuitable for implantation by releasing certain hormones. And the cervix will also become hostile to the sperms, thereby increasing the phagocytosis of the sperms. So again, these hormone releasing intrauterine devices are inserted into the uterine cavity through the vagina, and they are like different brand names of these: Progestarset or LNG20. There are many more, but you must remember these two names. And the implantation, that is the meeting of the sperm with the ovum, is hampered by making the uterus unsuitable for implantation because they release certain hormones that does not allow an active implantation to take place. The cervix also becomes hostile to sperms and increase the phagocytosis, again the killing of sperms. So intrauterine devices in general have advantages and disadvantages. So the advantages of using the IUDs is that they help in delaying pregnancy and space children. So intrauterine devices are one of the most widely used devices by married couples. So either if the couple does not want to have kids, they can insert an intrauterine device and delay having kids or delay pregnancy. So this is the first case. So in certain cases, what happens is that once a baby is born, the couple wants a certain years of gap, let's say 2 years or 3 years between the second baby. That is, they want to space the children. And in such cases also, intrauterine device is very important. And because it is advantageous, in India, it is a very common method of contraception. Now coming to disadvantages. They may cause irritation and make the egg to move down the fallopian tube and uterus prematurely. And this is very important to take care. So when you go to your doctor or the healthcare professional that is going to insert the intrauterine devices, they will check up your body, and every body is different. So in certain cases, it may cause irritation and make the egg to move down the fallopian tube and uterus prematurely. They can cause excess menstrual bleeding and pain. This is another disadvantage. And there is also risk of perforation of uterus and therefore an infection. Although the disadvantages are very bad, and they also look much more compared to the advantages. These disadvantages generally take place in a very less population of women. But it is very important to consult your doctor before inserting a intrauterine devices. But they are still the most commonly used method of contraception and also the most effective ones. So this brings us to the end of the second contraceptive method, that is the barrier method. And to summarize again, we looked at condoms that can be used for both men and women, and they are very easy to use. And then we looked at diaphragm, cervical caps and warts that are used for women and are quite similar. And then we looked at the intrauterine devices that were non-hormonal. And in non-hormonal, it is very important that there were copper-releasing intrauterine devices. And the second ones are hormonal. Okay, so these are all the 5 barrier methods that are available for contraception. So another method of contraception are the hormonal methods. That is the third type of methods we are going to talk about, and we will see how the hormonal methods are achieved and the mechanism behind it. So first we talk about the oral contraceptives, and since they are taken orally, they are commonly known as the pills because they are taken orally in the form of pills. Oral administration of small doses of either progestogens or progestogen-estrogen combination is another contraceptive method that is used by the females. And these combinations of different hormones are in the form of pills. So these pills, how should they be taken? So these pills should be taken daily for 21 days starting within the first 5 days of menstruation. And then a gap of 7 days should be given during which menstruation takes place. So it should be taken for 21 days and then a gap of 7 days should be given. So you take it for 21 days daily and then you do not take it for 7 days. And during this time your menstrual bleeding will take place. Then again for 21 days you take it. So it should be basically repeated again and again as long as the pregnancy is not desired. So you take it for 21 days, don't take it for 7 days, and during this time your bleeding occurs. Take them for 21 days, again for 7 days do not take them, menstrual bleeding occurs. 21 days, 7 days, and keep on continuing this until the time you do not want to be pregnant. So next we see the mechanism of action of these pills. So for that, let us first look at the menstrual cycle. So the whole cycle is highly regulated by various hormones. For example, LH or the luteinizing hormone and FSH or the follicular stimulating hormone. And these are also called as the gonadotropins because they are released by the anterior pituitary gland. These gonadotropins LH and FSH further also affect the hormones in the ovaries or the ovarian steroids, here for example estradiol and progesterone. So what happens during the ovulation? So during the ovulation there is a peak of LH and concomitantly there is also an increase in the level of estradiol, which basically makes the whole system susceptible to pregnancy. However, what do these pills do? So the primary action of the pills is to inhibit ovulation by suppressing the gonadotropins FSH and LH. So basically the pills will suppress the LH plus FSH. So this is where the pills are going to act, and as a result the levels of estrogen do not rise. Here the levels of estradiol within the ovaries will not rise. The mid-cycle LH surge, that is this red line here, this surge will not occur and ovulation does not take place. And this is exactly how it will look like, the levels of hormones. So the pituitary hormones, that is the LH and FSH, will be low, and also the levels of estrogen and progesterone will be stagnant, and that is how the pills will achieve their mechanism of action. And the cycle will keep on continuing until you use the pills. So then there are different types of oral contraceptives that one can take. So the first one is the combined pill. It contains both progestin and estrogens, and it is taken once a day for 3 weeks. That is again 21 days. To prevent pregnancy and also to regulate the menstrual cycle. The pills taken during the 4th week or the 7 days are inactive, They do not contain any hormones and permit menstruation to occur. So for the first 21 days, the pill that you take are active. That is, they contain the active hormones, so that there is a stagnant level. There is a low level of LH and FSH, and as a result of which there is no LH surge taking place, there is no ovulation taking place. And then for the next 7 days or the next 1 week, they are inactive pills. So these inactive pills do not contain any hormones, but they still are pills, and they permit menstruation to occur. So the most commonly used combined contraceptive pills are under the name Mala D and Mala N. Another is called as mini pill. It contains progestin only and it is taken every day of the month. Then the third one is centroman. So this is basically a non-hormonal oral birth control pill. It does not have the side effects of hormonal contraceptives. So what happens, if you take these hormonal contraceptives, you play with your hormones in your body. And as a result of which there are sometimes side effects. So this one is a non-hormonal contraceptive. Therefore, it will have very less side effects. And Saheli is a non-steroidal contraceptive pill that is taken once a week. It has a high contraceptive value and it is well accepted as it has very few side effects. So people can also use this as a very good contraceptive agent. So again, let's talk about certain risks, that the contraceptive pills have, and these risks sometimes can provide certain advantages and some disadvantages. So the pills provide protection against endometrial and ovarian cancer and reduces the risk of endometriosis. So although there are risks, but these are kind of positive risks. It prevents against endometrial and ovarian cancer and will reduce the risk of endometriosis. However, oral contraceptives may not be advised for women with a history of blood clotting disorders. So these blood clotting disorders or thrombosis. So, women who have thrombosis or blood clotting disorders should definitely not take these pills. Or women with cerebral blood vessel damage, migraine headaches, hypertension, liver malfunction or heart diseases. So women facing all these problems should not take the pills. Another thing is that women who take the pills and smoke, they face higher odds of having a heart attack or stroke than the non-smoker pill users. So you should either stop smoking, you should either stop smoking if you are using the pills, or you should try to use an alternative method of birth control that we have previously talked about in this video. So the other thing is contraceptive skin patch. So taking a pill can sometimes be difficult because you have to remember when to take a pill, or sometimes, due to medical reasons, you cannot take a pill. So for such cases, there are contraceptive skin patch. So these patches contain progestin and estrogens that are delivered in a skin patch that is placed on the skin, and it can be placed either on the outer arm or on the back or on the lower abdomen or on the buttocks, and once a week for 3 weeks. And after 1 week, the patch is removed from one location and placed in a new location. So let's say for week 1, it is placed on your arm, upper arm. For week 2, it can be placed on your back, and so on, so forth. For the third week, it can be on the buttocks. And during the 4th week, there is no patch. So if you see, the mechanism is still similar to that of pills, where you were taking the pills, for 3 weeks or for 21 days, and then you were not taking anything for 1 week or 7 days. So the mechanism here is again the same. For 3 weeks, you will put the patch, and for 1 week, there will be no patch. And during this time, again, the menstrual bleeding will take place. So the third hormonal method can be either implants or injectables. So sometimes, even with the patch, it can be difficult. For let's say you want to go for swimming. So sometimes it can be difficult to do that with a patch. In such cases, implants or injectables are another available method. Progestogens alone or in combination with estrogen can be used by females as injections or implants under the skin. So these are basically implants under the skin that are inserted. Again, their mode of action is similar to that of pills, and their effective periods are much longer, so they offer much more benefit than to that of pills. Norplant is an example, and it is a set of 6 small plastic capsules, as you can, see here. 1, 2, 3, 4, 5, 6. It is a set of 6 small plastic capsules which are placed under the skin of a woman's upper arm, and it contains no estrogen. Okay, so this brings us towards the end of the discussion of hormonal methods. And we saw first the pills or the oral contraceptives that basically target the luteinizing hormone and the follicular stimulating hormone in the anterior pituitary. And as a result of which there is also suppression of ovarian hormones. So all the hormones are basically stagnant, and there is no LH peak or there is no increase in the estrogen within the ovary, and therefore no ovulation takes place. And this prevents pregnancy. And these pills should be taken for 21 days and then not taken for 7 days. And similarly, you should continue this till you want no pregnancy to occur. So the next one we saw was the contraceptive skin patch. That is like a patch again with hormones under the skin, on the skin, not under the skin, on the skin, that can be either on the upper arm, it can be either on the back, on the lower abdomen, or on the buttocks. And again, one patch is at one place for 1 week. So for 3 weeks you have patch, and every week you have the patch at a different location, and then there is no patch for 1 week. So basically the mechanism is similar to that of the pills, but instead of pills we have a patch here. And the third one we saw was implants and injectables, and we saw Norplant, which is like 6 capsule structure that is under the skin. So these were the hormonal methods. So next we will look at the fourth method, that is surgical sterilization. So what is about surgical sterilization? Surgical methods, also called sterilization, they are generally advised for male-female partner as a terminal method to prevent any more pregnancies. These surgical interventions block gamete transport and thereby prevent conception. So this is the mechanism of action, that they block the gamete transport, either sperm or the ovum, and thereby they prevent conception. And they are advised only for the male and female part as a terminal method to prevent any more pregnancies. So either people who do not want to have any kids at all, or people who do not want to have any further kids. So this is only for those people. So the sterilization procedure in the male is called as vasectomy, and in females it is called as tubectomy. And now we will look at each of these. So what is vasectomy? So in vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum. So this is the male reproductive system. So this is the pair of testes where the sperms are produced, and then the epididymis here. And from the epididymis, the sperms move to the vas deferens. So in vasectomy, this vas deferens, there is a cut that is made in the vas deferens. And then this is tied up. So what will happen if something like this occurs? The sperms that are produced in the testes will move in the epididymis, but they will not move through the vas deferens. And since the sperms will not move to the vas deferens, there will be no sperms in the ejaculate. So there will be no sperms in the ejaculate or in the semen of the men, and therefore no pregnancy can take place. So this is what happens during the vas deferens. It is a surgical procedure. So during vasectomy. So now we talk about tubectomy. In tubectomy, small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through the vagina. So here if you see, here the fallopian tubes are cut and they are tied up. So both the protocols have the same mechanism or the same principle. One of the most important organs for gamete formation or for the movement of gametes is basically cut and tied up. So these techniques are highly effective, 100% effective, but their reversibility is very poor. Therefore, it should be only and only used by the individuals who do not want to have kids at all, or who do not want to have any further kids. So in this video, we saw different methods of contraception. The first method for contraception are natural methods. And under natural methods, we had 3 categories. The first one that we saw was periodic abstinence, where the women and the couple should abstain from having sex during the ovulatory period, that is day 10 and day 17 of the menstrual cycle. The second method we saw was withdrawal or coitus interruptus. So in this method, the men should remove the penis from the vagina immediately before ejaculation. And the third one that we saw was lactational amenorrhoea. And in this method, the mechanism is that while the woman is breastfeeding, there is no active ovulation taking place. So this can provide a natural method of contraception and no pregnancy can take place up to 6 months. But one should be very careful while using all these natural methods. The second method that we saw was the barrier method. And under the barrier method, the first one that we saw was condoms, that is available for both male as well as for females. The second one was diaphragm. Along with diaphragm, we also saw cervical caps and we saw vaults. And all these three are available for females. And the next one we saw were the intrauterine devices that can be either hormonal or they can be non-hormonal. And under the non-hormonal were also the copper releasing intrauterine devices. So condoms and intrauterine devices are the most commonly used barrier methods. The third one we saw was the hormonal method. And again under hormonal method, we first saw the pills. These pills, again, they suppress the hormone LH and FSH from the anterior pituitary. They should be taken for 20 days and then not taken for 7 days. And during this 7 days, the menstruation occurs. So the second one that we saw was the contraceptive patch. And these patch can be inserted at different locations on the body, like the upper arm, the back, the buttocks or the lower abdomen. And the principle is exactly the same. You take it for 21 days or you put the patch 1 week at a different location for 3 weeks and then you do not put a patch. And the third one that we saw were the implants or the injectables. And here we saw the Norplant, that are under the skin and they are highly potent. And the last method of contraception that we saw was surgical sterilization, and it is both available for men where it is vasectomy or for women where it is tubectomy. And these are both terminal methods. So should be used only when you do not want to have any kids or any further kids. So the major questions that generally are asked from this part will revolve basically around either the mechanism of action of pills or the intrauterine devices. There are a lot of questions about copper ions, like what do the copper ions do? So they will inhibit the motility. There are also sometimes match the following questions, like you have to match that which is the natural method or which is the surgical method, They will give you different questions about match the following. And another topic from where there are questions that we saw in the key terms is amniocentesis. So it is very important to go through all these things very nicely for the examination. So the selection of a suitable contraceptive method and its use should always be undertaken in consultation with a qualified medical professional, because every body is different and there are certain things happening in each body. So therefore it is important that except for the condoms and the natural methods, you should always try to consult a medical professional before taking or before using a particular contraceptive agent. The major advantage of using the contraceptive methods is that it plays a significant role in checking uncontrolled growth of population. However, there are possible ill effects, like nausea, abdominal pain, bleeding, irregular menstrual bleeding, or even breast cancer, though they are not very significant. But they should not be totally ignored. Therefore, the first point, that is, you should always consult a qualified medical professional before adopting any contraceptive method apart from the natural methods and the condoms. Thank you for watching the video.